maybe have not attended some sessions before, my name is Jenna. I am on the customer engagement team at TDS Health, and I'm joined by my colleague Kate, who's going to do some watching over the chat and question answering as those come up. So thanks for hopping on. I'm going to go ahead and get my screen shared so we can get going. Please feel free to utilize the chat functionality if you have any questions that come up. Kate's going to keep an eye on that for me as we go. And we're going to go ahead and we're going to go through one of our new exciting partners with TDS that's called EKGaction. There's going to be 2 courses within there we're going to focus on today. And then we'll open it up to questions, discussion, and kind of talk about how that fits into the TDS Health threshold of collections. So I know we probably have a mix of maybe some current clients on the call, as well as some hopefully potential clients in the future. So thank you again for taking the time to meet with us and learn a little bit today about EKGaction and that new addition to our threshold. Let's go ahead and get going. So, like I said, we're going to go ahead and talk about EKGaction. We've got our topics on the screen here today to show a little bit about what we'll be talking about. So, we are going to open up the discussion to talk about a little bit as to why TDS elected to kind of move in this direction of partnering with EKGaction. So, for those those on the call who are current subscribers, you'll probably notice that we have a wide variety of education tools that we have within our tool belt at TDS. And that's intentional because we like to find gaps in areas within education that we can support with. And those are the types of partners and educational tools we look for. And so EKGaction really fit into that mold where we started to see some gaps in understanding of EKG fundamentals and the ability to interpret those from both residents and students. So with that in mind, we'll take a look at the 2 different courses within EKGaction today, both the Learn It Well course as well as the Advanced course. And then you'll notice there at the bottom, that last little lonesome bullet point is that we're going to have looks like coming soon, we'll be having an EMT course. And so once we have more details on that, we'll be able to share it. But that's something to look forward to that's up and coming. So as a point to talk about the challenges in student and resident understanding of each EKG fundamentals. I am not a resident. I am not a student. My background is in medical microbiology, so I've lived within that world. But one thing that we started to see when working with clients is that EKGs falls into that area that almost seems like you're not sure what you're going to get when your students get to the resident level. So they graduate that undergraduate education, they get into a residency program, and they start rounding and doing some work to where they would expect they would have seen EKGs maybe in a textbook or in their rotations in undergraduate medical school. But we're not really sure how often that really happens. Some people are lucky to see a lot of that, some people not so much. And so Dr. Chavone, who's the founder of EKGaction, who is a renowned cardiologist, he started to see that working with the residents that he was teaching, that was coming in and rounding within the institution he was supporting at. And he was noticing just these huge gaps of understanding. So some people had seen a lot of EKGs, they knew how to interpret them, they were comfortable, and some they hadn't even seen one before or worked with a patient that had an EKG performed. And so with that, that's where the development of the introductory course that we're going to take a look at started. You may hear introductory course and think intro, truly, kind of makes you start to think it's low level, but it really is designed to be an all-encompassing introduction to the EKG to get the medical student or the resident familiar with the material to where they're able to actually utilize EKGs in their practice and have a thorough understanding. And so don't let the idea that it's an intro course make you think it's not up to par for a resident or a medical student. It's treating it as if this may be the first time that resident is seeing it, all the way to where they have a mastery of the material. The advanced course is going to be a little bit different. That's going to be more geared toward those who are practicing in the cardiology world or are in those advanced fellowships that may have already developed such a strong understanding of EKGs, but they want to have exposure to additional cases and content to really brush up and strengthen their knowledge. I am going to go ahead and move us to the introduction portion, and then I'm going to come back to this slide that's going to talk a little bit more about the differences in the two as kind of a way to round it out at the end. Um, Kate, are there any questions or anything popping up in the chat that I need to take a look at before we move over?
No, you can go ahead.
Okay. Alrighty, let's go ahead and get out of this presenter mode real quick and pop over. Perfect. Give me one second. I'm going to go ahead and switch the sizing on this. Apologies, everyone. A little bit of technical difficulties on my screen. It loves to go ahead and hide itself when we're sharing. For those who are on the call that are supporting at the GME level, so looking at residency programs, I'm going to go ahead and talk over this while I switch things over. When we talk about residents utilizing the introductory course, we're going to be looking more towards those who are residents coming into family medicine, internal medicine. So some of those key areas, even emergency medicine, I would say, would be able to utilize this. So I get some questions as to which groups would be supported by this intro course. All right, now it looks like we're good to go. So what you're going to see here is my EKGaction account. And so I'm going to have access to both the Learn It Well course as well as the advanced program. You'll also notice in here that we also have a chest x-rays course as well. So these are the 3 active programs within the EKGaction threshold. We talked about that coming soon of that EMT course. And so like I said, once we have some info on that, we will let you know. But this is what you would see if you were to access your EKGaction account. And then up here, you'll see that we've got the ability to create a new class as well as this customer engagement study plan. That's what we use for examples. So I have administrator functionality to build new classes and do things like that. Which there is that functionality within the EKGaction collection is for administrators to be able to create classes to look at resident performance and all of that good stuff. We're going to go ahead and start in the Learn It Well course here. And so you'll see we've got a couple of different categories here that we can take a look at. So like I said, the founder, Dr. Chavone, he really built out this course to be an introduction all the way to where you have a deeper understanding of EKGs. And so you'll see that each of these table of contents are built out from some introductory chapters that are going to cover some of those key areas you'll need to understand to really introduce EKGs into your mindset, into your curriculum that maybe you've had before, or maybe some reminders of some things that you might not remember from when you were in your undergraduate medical school program or those early stages of your residency. So we've seen this utilized anywhere from in an undergraduate medical school program, the first year of residency, later on in residency as a refresher. So it can support in various areas because you have that full course in here to support you. In each chapter, you'll have different covers of different content, but then you also will have some of these review quizzes that pop up through here. And so you'll have each of these will have a review element as you move through to be able to test your knowledge and take a quiz to see that you're understanding and covering that material as you go. And so you'll notice that applies all the way through, that we move through, I believe it's roughly 20, yeah, 20-ish chapters in here that we have. And then at the end here of the introductory course, we're going to have some cases. And so you're going to have really that true course style introduction all the way through with those first 20-ish chapters. And then you'll end out the course with some cases, which we'll take a look at. I want to also point out, in addition to the actual course itself, within that table of contents, you'll have an alphabetized index, which will link out to different locations of that material. So whether that's different chapters or figures throughout the course to refer back to certain subjects as you meet them, that's something in here as well. I do have some clients who utilize this as an added bonus. So once even they've completed the course or they go back to review their material, they use this subject alphabetized area to go and look at content, that material that's coming up maybe within lecture or within their rotations, because you've got different figures and reference points for them. If you're really focused on those figures specifically, so you want to see that imagery shown to you, that content that's in there, this index in here will link out to those different figures that we have within the course as well. So the course is all encompassing in one area that's designed intentionally, where everything you may need to complete this is in one space, and you're able to flip back and forth between the material. And then lastly, this section here allows you to look at the last 3 results of the quizzes and the review questions, as well as um, the cases and content that you'll have in here. So you can go back and look and see how you're doing. It'll look at the last 3 attempts that you have. Like I said, I am not a resident, so I could maybe have a few more scores in here, but that is where you're able to go back and refer back to your material. I want to quickly open up the course content just to show you all a little bit. So like I said, we've got some introductory material, but let's go ahead and pop open like our second chapter so you get an idea as to what this looks like. You'll have your chapter here, and then really you'll see it's almost like we have a textbook intertwined in here with different content that's called out, and we're able to move through here. And like I said, we've got the different figures and material that you can reference in here as you go, as well as a search database up here if you want to look for particular content in here specifically. But I do feel like one thing that people really want to take a look at are those cases. So really having an introduction to those actual EKGs once you've completed this course. And that's going to be down here at the bottom. And so what you'll see is that we have the different cases in here that you can select from. They are designed to go in order, so starting at 1 all the way through 8. And so if I open up case 1, I want to point out a couple things in here for your review. You'll see that you have your EKG as well as the instruments needed to complete, assess, and review this EKG. And then you'll have an option to create notes, write notes about this, things that you're noticing as you're moving through your interpretation. And then down here is where you're able to actually make that assessment of your interpretation and indicate the different features and abnormalities and details that you're seeing within the EKG. I want to point out that the grading scale in here is intentional, to where you obviously have various different topics in here that you can select from to make indications of things that you're seeing. So I can select across various areas. But I want to point out that intentionally, not every section is going to have something that's presenting. Some things will have more than one. And that's done because you never know what you're going to see when you're interpreting in the clinic in rotation. Some things are going to present where others won't. And so, for example's sake, I'm just going to make a few selections so I can show you all what that grading looks like once I submit that. And so once I've made all the indicators within here of things that I think I'm seeing within this EKG, I would hit submit. And then it's going to break down how I did, maybe not so great. And then the incorrect answers that I selected, the answers that I selected correctly, and then the unselected answers that I should have selected from the options. And so It'll break down where you've answered incorrectly, where you've answered correctly, and then the things you didn't select that should appear. And so you'll notice that the scoring in here, I made enough incorrect selections that were not presenting to almost void my correct selection. And so it really is there to show that you're making correct interpretations of the actual EKG itself. And that style of interpreting the EKG, making those selections, that's going to be applied in all the cases in here. So it's the same formatting, but we just have different cases that you're able to move through with different presentations. And again, like I said, down here, you'll see a breakdown of each of those in yellow. The correct answer that I did not select, the green is the correct answer that I did select, and then the red are my incorrect selections that I made as I was interpreting this EKG. Any questions or anything?
Yeah, Jenna, there was a question on applications for nursing school, and I can take that quickly. And I did put a note in the chat as well. This is more for graduate nursing, so nurse practitioner programs, as well as PA programs. And you mentioned undergraduate medical education, as well as um, obviously residency, as we're talking about in terms of Learn It Well. So wanted to point that out. In the future, there could be applications certainly for undergraduate nursing, and as we talked about, EMT as well. So just wanted to point that out as you're going through Learn It Well.
Yeah, definitely. And it's a good question about nursing, and especially at the nurse practitioner level. I mean, I'm in Arizona to where I have nurse practitioners that facilitate their own practices on their own, a lot of family practices. And so you may have patients who are coming in with EKGs, or you're having EKGs sent to your office for interpretation, and it might have been a minute since maybe you've seen one while you were working bedside or even in your nurse practitioner program. So yes, I'd say that graduate application definitely would be applicable for nurse practitioners and, like you said, PA providers as well. That is the main rundown of the Learn It Well course and how that looks. I did want to shift gears over to the advanced course, which is going to look really like a continuation of the Learn It Well course. It's going to look very similar, but obviously the material is geared a little bit differently toward those who are more practicing in the cardiology space or in those advanced level courses. And then I'll touch a little bit on the administrator functionality in here as well. So down here, you'll see that we have that advanced program that I can open up here. Um, and I cannot stress enough Dr. Chavon's exposure in this space. He has published textbooks, he has supported in several studies, and he has been a huge advocate for making sure that residents, advanced practice providers have access to materials to really understand EKGs and have the best potential exposure to those prior to them getting into their GME practice, in their GME practice, and then after when they're serving as an attending or at a higher level of advanced practice provider. And so with that is where we have the development of the EKGaction course here. And so what we're looking at here is that advanced course. Um, You'll see it's going to look a little bit different to the Learn It Well course that we took a look at before, because we're really going to be focusing on cases specifically. And so because this section is geared more toward those who have had exposure to EKGs, they're at an advanced level of their practice where maybe they're interpreting multiple of them. They're looking at very high level cardiology applications. This is more designed to be a way for them to look at different cases and reinforce that information. And again, maybe see things that they haven't seen. So Dr. Chavon, being in that space for a while, has had a lot of exposure to EKGs himself, and therefore he wanted to share that wealth of knowledge with others who are in the space. And so you'll see that we've got learning cases in here that are really focused on brushing up on concepts, different learning cases that maybe one hasn't seen as much, some more of those rare cases. We've got some supplemental cases in here as additional case support for those, as well as a practice test in here. And so these are the different types of material within the advanced course, as you'll see, we're more built up and beefed up in that case application because the expectation is that the user has seen this material before, they're practicing, and they're looking at this more so to be able to refer back to material and maybe see something that hasn't produced itself in clinic regularly or recently. And so you'll see it's going to look similar in the way that you can look at your scoring for the last times you've seen certain cases. You can flag them for your reference to refer back to if there's something that maybe you don't remember, or let's say that you actually have someone, a patient, something presenting that one of your residents, if you're supporting a program, is presenting with, and they have a patient that's looking like something specific, they can look at this material. And again, if we open up a case, you'll see that it looks similar to the Learn It Well course, where you'll have your instruments in here, as well as those abilities to make those selections of the different material that you're seeing presented within that EKG. Um, you can reload your most recent answers, and so if you are retaking this and you want to throw in what you answered last time and then maybe do some assessment if you want to make some changes or adjustments, you can do that as well. And again, I'm just going to make a couple of selections in here just to show you all once we submit that. Again, we'll get that breakdown, how we scored, the correct answers that we did not select, and then a breakdown of what those were in here for us to refer back to. And so similar in structure of how it's laid out, but where that Learn It Well course is going to have that full course to give you that introduction, those review quizzes to get you familiar, and then cases to apply that knowledge. The advanced course is going to be really just deep diving into the cases, the expectation that you have the material from before. You still can look at those glossaries and indexes of different things to refer back to certain material, but we're focused more so in the actual cases. Are there any questions on how the different programs work? I know I covered two of them really quickly, both the Learn It Well and the advanced course. Is there any questions, comments, concerns, favorite color, anything like that with us?
No favorite colors, but there was a question about access, how access works.
Sure, that's a great question. So, the EKG action product thresholds are going to be accessible. This is all a web-based style program, and it's going to be utilized with a creating a user account. So you'll have a access link for your users, whether that be your residents, your practicing fellows, whoever that is that you're going to have access the material, where they would register and create an account utilizing their institutional email. And then we actually have a separate registration link for administrators where they're able to go in and create an account where they can create different course groups or cohorts or departments where they can review their actual progress and see how they're doing. And so those are the two access models of different links, but it's going to be from a, you create an account using your institutional email. Quickly, I just want to point out some of the elements of that administrator functionality that I've been touching on. And so again, we've got our customer engagement study plan class here that we have as our example. So you'll see our couple of enrolled students, which are my colleagues in my department, and then Kate serving as the administrator for the course. And so in here is where you're able to look at the different learning modules that you have access to. So for us, we've got all of them in here, and then we can monitor progress and look at our different enrolled students, how they're doing as they move through. So if I wanted to look at the different material, if I want to focus on the introductory course here, I'm able to look at those. I can monitor progress of how my students are doing on each of these. I can select each one, pull them up, and I can look at how they're doing on each individual one. Versus here is where I can look at an overall review of all of my students. So, who's number of students who've attempted, percent of them getting correct. So we can look at our groups at a large scale level or at an individual level, depending on what we want to see for each of our groups. And this is applicable for the advanced course as well. The other piece that I want to point out in here is that we have this custom cases section in here. And the reason I want to point this out is because the product is designed that if you have additional material, let's say that you as an administrator, you have an EKG example, or maybe you have some supplementary imagery or figures that you could create questions that might support in the learning of those completing the introductory course or the advanced course. You know, if there's something that your site from the when you had Joint Commission come through and you want to make sure everyone is prepared for that and you have an element that you want to add in a case question for your attending. So whatever that option is that you want, you can create your own questions in here like a custom case. And so if I add a new custom case, you'll see that I have kind of a blank slate of what I can put in. I can have a case presentation, diagnosis, as well as learning points. And then I can add in files and material to have in here that will then intertwine into the courses that your users are utilizing. And so you can add in your own custom content if you have maybe something that particularly you want them to focus on, or like I said, if you've got something specific to a certain department that you want to add in collaboration with the other material in here, you have that option to put that in here. And then also the ability to run usage reports. And so that's just something I want to point out, that if you want to run reports on how often people are utilizing this, how much is getting, pushed out by different departments. If you've got like a large scale subscription, you have the ability to run usage reports and look at that granular detail in here as well. That concludes my presentation of the EKG action collection. I'll go ahead and stop sharing. I'm going to switch back over to my PowerPoint if I'm able to, but I want to see if there was any questions or anything that came up in those last bits of presentation.
Yeah, there's two questions.
Sure.
Are the usage statistics within EKG Action able to be consolidated with other TDS Health products that my library may already have?
Wow, what a great question, and what a fun and amazing thing that if that was something we could do. So we right now they're not integratable with other products, so it's not something that you can integrate. I'm wondering for that user if you're accessing like our StatRef ebooks that you're running those usage reports, or if maybe you're accessing some of our question bank tools, things like that. Right now, they're not able to be integrated together. You can export material out and such, but it's not like, well, unfortunately, we can select, 5 or 6 bullet points and run all the products at the same time. They're going to be individual reports.
Yeah, but the rep can do an analysis of the full collection that is purchased by TDS Health, but that's a good point. They're not combined. And then the other is what is the process of incorporating the EKG action modules within Blackboard or similar course management systems?
That's a good question as well. So, to my knowledge, right now, EKG Action does not have a full integration tool or embedding functionality within it to be able to embed content directly into those LMS systems. But, like I said, it is a web-based application. And so, what we do see for people who try to kind of keep things all within their LMS is they'll design a page, whether that's in their course page, within a LibGuide, wherever that is that you like to have those things live, have those links, instructions, and details there to where it links out to the product to where they're able to go there directly from within the LMS versus it embedding directly in there. So the workaround being that with this being a web-based tool, it's not forcing you to download something to the device to where you have to live fully outside of the LMS, but you would be having to link the material from the LMS system to EKG Action. It's not going to live within the LMS specifically. I hope that answers that question. Okay. I'm just going to quickly pop back with 2 minutes left because I noticed earlier my viewing was a little zoomed out to where you couldn't see the last bits on this page. So as a kind of final follow-up to the material we took a look at today, we looked at those two different courses within EKG Action. So depending on the area that you're supporting, whether that's both undergraduate medicine, residency, programs, or if you're looking at more for your attendings and those who are in practice, or maybe both. There's two different types of courses in here that may be supportive to you. So the EKG Learn It Well serves as that introductory course, covers those EKG basics to where you're then able to engage with those real figures, looking at those tracings and being able to use those clinical applications to start to understand EKGs and use them in practice. Or the advanced course is going to be that case-based material where you're going to be utilizing that to interpret those and really brush up on those skills. It's more ideal for those who are at that fellowship or advanced practice level. But that concludes our session. Thanks to everyone who took the time to hop on, both current clients and potential clients in the future. We'll be sending out a recording to those who attended if they want to be able to review that, share with those who maybe weren't able to attend. And please don't hesitate to reach out if you have any questions, if you need to learn a little bit more, or if you're interested in exploring and adding this on to your current collection. We're here to support that. Kate, anything else you want to
Great.
add before I close us out?
No, thank you, Jenna. Have a great afternoon, everyone. Take
Sure.
care.
Thanks, everyone. Bye.
Bye.